Our autumn-winter vaccination programme has now begun, and our immunisation teams will be delivering thousands of flu and COVID vaccinations over the coming weeks to different groups, including people living in care homes, over 65s, pregnant women and people with health conditions. One of the most important groups that will be offered the vaccination is health and social care workers, which includes all of our staff in NHS Tayside, also care home workers and other frontline social care staff, primary care contractors such as GPs, dentist staff, community pharmacy and community optometry staff. We know that people may not see flu and particularly COVID as the significant concerns that they were in previous years, but these can still be quite nasty bugs that at best can disrupt your work and your home life for a few days, or at worst they can cause very serious illness that can result in hospitalisation and other complications. So we've been offering the flu vaccine to all NHS Tayside staff for many years now, and frontline health and social care staff are also eligible for COVID vaccines. It's vital that staff continue to take up this offer, as there are different strains of flu and COVID circulating each year, and even if you've been vaccinated previously, you do need to get it again to protect against the viruses that will be expected to be circulating this winter. Aside from protecting ourselves and our families from illness, we also all have a responsibility to our patients. Many of the people we see in our hospitals, community facilities and in their own homes are particularly vulnerable, and we must do all we can to stop the spread of infection. Vaccination is one of the most effective ways of doing this. Another thing that we have to consider is the impact that staff illness can have on our services. Winter is already a very challenging time for health and social care services, with high levels of seasonal illness in the community and in our hospitals. Also slips and trips in the icy weather and the very busy festive period. So we need all of our staff to stay as well as possible to help us through this time. And it's really important for all of our staff in NHS Tayside, as well as those in social care and primary care, to get the flu vaccine and, if eligible, the COVID vaccine too. I've just had my flu vaccine this morning, and I'd urge all of you to get your vaccinations too.